dear learners. You're most welcome once again. Hope you're all doing well. So today we're going to look at changing linen from side to side. Yes. So before we look at the procedure, we have to know what the requirements are. And on our trolley, we shall need a clean bottom sheet. We shall need a draw sheet, and then lastly a draw Macintosh. And at the bedside, we shall need a screen as usual for privacy. We shall need a dirty linen container for putting in our dirty linen. We shall need a basin or a bucket with a disinfectant, just in case the linen is soiled. We shall need 2 chairs for stripping. And then lastly, we shall need a hand washing facility. So it being a 2 nurses procedure, we require an assistant, and Sister Frida will be the assistant. You are most welcome. Thank you. Okay. So before starting with the procedure, hand hygiene is a must. So we have to wash our hands or scrub our hands with an alcohol and rub together with my assistant. Don't forget, we should always stand in the middle of the bed to reduce on the movements. And then we strip our linen. So before stripping the linen, we have to untuck in the linen and then fold them. We can start. Remember, when we are changing side to side, the patient is in the bed and the patient won't leave the bed. So as we are performing the procedure, the patient will stay in the bed. We start from the counter pen. Then we go to the blanket. However, we're going to leave the patient with the top linen and then untap the bottom one. Okay, after that we are going to strip our new or clean bottom sheet, fold it lengthwise to ease work. Hope you're able to observe. So now I can put it on our chairs. We fold the draw sheet. This one will be folded in a width way, not lengthwise. And then lastly, our Macintosh. So after that, we have to remove all the other bed appliances. Mr. Mulago, hold on a bit. We have to introduce the procedure to the patient. Mr. Mulago. I'm now suffering together with my colleague, Nurse Frida. We would like to change your bottom linen so that you'll be comfortable and be in a clean bed. Are we allowed? Yes. Thank you. So remove the appliances which are not necessary. Put it on the bottom shelf. We can remove the backrest. Then untap the bottom linen. So as we are changing linen from side to side, the main nurse helps the assistant to put the patient in a position whereby she can get space to make the bed this side. So this patient will be lifted or positioned and will be supported by the assistant. Make sure you do the patient covered. And then the main nurse has to remove or to roll the draw linen and then the draw Macintosh together with the bottom sheet. So after that, you straighten the long Macintosh, remove any creases or dirt. Then you get the bottom linen. Spread it on the bed. So you make sure you tuck in the top and meter the corner. You do the same to the bottom, tuck in and meter the corner, then you tuck in the whole linen. After that, you get your draw Macintosh. You spread it on the bed as the assistant is still holding the patient. You tuck in and then you get the draw sheet. Then you also tuck in. So after making the side of the bed, you hold the patient and then the assistant holds you to make the other side of the bed. Can you send me the patient? Mr. Mulago, hope you're okay. So I'll be supporting the patient as my colleague completes the other side of the bed. Mr. Mulago, hope you're well. You keep talking to the patient as the procedure is ongoing. Don't worry, all will be well. So my assistant will also tuck in the top and meter the corner. She will do the same at the bottom and still meter the corner, then tuck in the whole linen. So after that, she will get the draw Macintosh and then the draw sheet. And she will tuck it in. So when the bed is done being laid, we are going to position the patient back in bed. Mr. Mulago, hope you're well. Make sure you don't leave the patient exposed at any minute. We get our blanket. We make the bed as a normal bed after changing. And lastly, we put our counter pen to keep the patient warm in bed. You make sure you lift the bed when it is neat. So in case a patient feels like using a pillow, you can offer a pillow to the patient. Mr. Mulago, would you like to use a pillow? Yes. Okay. Help me support the head. You make sure you make the patient comfortable. And a point to note, because the patient was using a back, you put it back. You put every bed appliance which the patient was using. So a point to note, the dead linen was put in a dead linen container. We never had any soiled linen, so nothing was put in the basin. Mr. Mulago, thank you for being cooperative. And that marks the end of the presentation. We have to wash our hands and then clear our way.